Welcome to Nightingale View. This video is about the parts of the syringe and needle and how to recap the needle by using a one scoop method. This is called barrel and this is called plunger. So plunger will be useful to withdraw the medications and barrel will hold the medications. And this barrel, if you see, there is a calibration. This will help you to measure the amount of blood or the fluid or the drug has been taken, either 1 ml or 2 ml. And about the plunger, you have a thumb rest. This is called thumb rest, where your thumb will rest while you are withdrawing medications or fluid or blood. And this is called flange. So in a barrel, you have a flange. So in a flange, this two finger will rest and this is the thumb rest where you will keep your thumb in order to pull or push the medications. So this is a method of holding the syringe. Now about the needle, parts of the needle. This is a cap. When you remove the cap, you can see there are three parts. This is called hub and this is called shaft and the tip is called as a bevel. Now the syringe has been used. In case if you want to recap, you have to use one scoop method. By using only one hand, just insert the needle into the cap and against the wall or against the firm surface, you can lock the needle with the cap. So this will prevent the needle stick injury. If this video is useful, please do like, comment and share. Thank you.